lives. Could you perhaps share with us a story of when you've applied original medicine, maybe somebody who had a health ailment as a result of some of those heavily meat or milk, dairy-based diet, and how that
Mhm.
original medicine, applying those principles, really had a significant benefit in the person's life? Wonderful, Jim. So I think that's kind of given a very good overview for anybody that's interested in original medicine. Now, that there may be some people that are watching this video that perhaps have other professions, other careers, and they're interested. Okay, how can I learn more about this to apply it for myself or my family? So, what are the options in terms of starting to um, develop your knowledge and understanding in the field of original medicine from somebody who's watching this video now and says, hey, I
Mhm.
want to know more? What kind of options are available to them, generally speaking, to know more about original medicine or the natural perspective, if I can describe it
Yes.
that way?
Yes. Another very good question. And there's a lot of schools out there. There's a lot of schools of naturopathy out there. There's a lot of different schools that focuses on health and vitality. What we've done was we've looked at a lot of those schools that are out there, especially the distance learning schools. And what we've done was we've taken the best out of what's in those programs. And what we've done essentially was we've added to those things and we've integrated into the program the original medicine portion. We're the only original medicine school of higher learning in the world. It's the most integrated, the most comprehensive program in the world. It's biblically based, and that's essentially where we're a little bit different from everybody else. We have as the foundational basis of all of our course material original medicine, and everything is built off of that in terms of the types of courses that support this original medicine, the original medicine concepts and principles, and basically validate from a scientific basis and elaborate on it from a personal standpoint and also from a practical standpoint.
Thanks, Jim. You mentioned in that answer, in terms of what options and opportunities are available, you mentioned the IIOM program and curriculum. Could you maybe just expand a little bit more on that and what's included there? Because I know that the program does range at different academic educational levels based on your needs and requirements.
Yes, yes, absolutely. There are essentially three certificate programs: certified nutrition counselor, certified herbalist, and certified medical missionary. And soon to come, an accredited certified RBTI course or curriculum, certificate curriculum. So currently it's three going to four certificate programs. And then we cover the full spectrum of degree programs from the bachelor's all the way up through the master's, doctorate, all the way up through the PhD program. So as I said, we have the most comprehensive, the most integrated, and the most complete program of original medicine in the world. And we have it to suit a lot of different interests, a lot of different needs, and all the way from personal home use all the way up through the practitioner capability.
Wonderful. Thank you, Jim. So maybe I could just, this has kind of been very descriptive and it's, from my perspective, very compelling and I hope interesting for people that are watching this video. But maybe you could give a practical story. That's the theory, the 8 laws of health, original medicine. You've said it's positive, but, maybe you can share a story from your many years of having a practice in terms of giving the original medicine perspective and applying it in people's lives. Could you perhaps share with us a story of when you've applied original medicine, maybe somebody who had a health ailment as a result of some of those heavily meat or milk, dairy-based diet, and how that
Mhm.
original medicine, applying those principles, really had a significant benefit in the person's life?
Yes, and I'll be happy to. I'm trying to think through. I've been doing this now for going on 30 years. And so to pick out one particular one might be a little bit challenging, but that's all I practice is original medicine. So it's not like where did I apply original medicine and it worked? It works in so many different things. I guess let's talk about the one that most people die of, cardiovascular. Over 50% of the people here in the United States die of some kind of cardiovascular issue. And what I would share with you is that by practicing original medicine, over 95% of the cardiovascular issues would just disappear overnight, and only be about 3 to 5% of them. So, for example, I've worked with people that have been on 6, 10, 11 medications. And the medications, as you know, medications, they need to have to be increased or changed because of the adaptation reflex. And I've seen people in as little as 3 to 6 weeks be off all of their medication, good blood pressure, and things of that nature. So I'm thinking of some of the specific ones, but I can go chapter and verse on how effective it is for that, how it is for diabetes, for weight management. You know, there's 10 different factors that affect all health issues. You know, infection, inflammation, malignancy, etc. There's 10 of them. And original medicine is the best way of addressing all 10 of those factors. So what the medical folks do is they give nice Greek sounding and Latin terms for these things, but it's not all that complex. Like I said, there's 10 things, you know, and so where they would use antibiotics, I use antimicrobial herbals and clean out the body. So I mean, I can go chapter and verse on the many different things. You know, I've had one person who's had acid reflux for 11 years, taking, I'm not going to mention the medications, taking various medications, and the situation was solved in a week with proper food combining and with, you know, managing the dietary input. So people are just keep doing the same things over and over, expecting to have different results until they get on the right program, you know, the right paradigm. And original medicine is so powerful that it doesn't take a whole long time in many instances to be so effective. So it's a very, very powerful protocol. And I can't think of any situation where it doesn't work. Well, I think I can. There's one area where I rely very heavily on the power of conventional medicine, and that is in the area of trauma. If somebody gets shot, if you get hit by a Mack truck, you don't talk about original medicine. You don't talk about herbs. You don't talk about diet. You talk about getting me to a hospital real quick. And that's where original medicine acts as in a secondary mode to just enhance and accelerate the healing process. So I mentioned those 10 factors. I didn't go through all of them, but there's of those 10 factors, one of them is trauma. And the problem is conventional medicine is trying to address all 10 of them when their forte is in this area of trauma. So it's in my judgment, it's a reason why they call it the practice of medicine, because they have to practice on the 95% of the people that don't need it, so that for the 5% that need it, they are very honed and skilled at providing that. So and all those other 9 factors, whether it's psychological, whether it's genetic, and interestingly enough, one of those 10 factors is called iatrogenic, that which means it's a fancy word that means it's medically induced. So obviously, if you're not using the medical protocols where it's not appropriate, you're not going to have a medically induced issue. So as I say, there's these 10 factors, and I love talking about it just because it empowers people. You don't need to know the names and definitions of 300-400 few thousand different diseases. All you need to know is these 10 factors and how to address them from a medical or an original medicine or a chiropractic or whatever other modality. It's just that original medicine happens to be the most powerful, and it supports all those other different modalities. But without original medicine, you are compromising the functional integrity of any of these other systems. Another way of saying is the more you use original medicine as a part of your practice, your modality, the more successful and the more effective you will tend to be. I hope that helps to put that in some kind of perspective for you.
Okay, Jim, thank you so much, as always, for your time, for your kind and very generous time to kind of just talk with us and share more about IUM. The final question I can ask, if I may, from perspective as president of IUM, why should somebody study at the International Institute of Original Medicine if they want to develop their journey and take a step further? Why should they study at IUM?
Seth, that's a powerful question. And it's a variation of the question I usually get. Why should I come to IIOM? Why do I need this? And what I tell people is, oh no, you can go out. There's a lot of good health books out there. There's a lot of good material. You can go and study it on your own. What we've done was we took the time to look at the entire area. I have a lot of experience. It was a hobby of mine for 20 years while I was in the business world working on my own health before I embarked on this program. But what we've done was we've put together a complete program for you that's self-paced. You can study it in your own time and space. And it's the most comprehensive program out there. We have 7 different categories of programs. We have the original medicine, which is the foundation. We have nutritional courses. We have herbal or botanical medicine courses. We have alternative medicine. We have conventional medicine. We have the health assessment and professional development. And then we have the finishing courses, you know, the practicums, the dissertations, the projects. So when you come to our school, you're confident that this is a very well thought out, a very complete, and the most comprehensive program that I know of that's out there. And I've studied all the major programs. I myself got my 3 doctorates from distance learning programs. So I know what's out there. And I got my PhD from basically very quickly because I had all this basic knowledge. So I have a knowledge of the area. Like I said, it was a hobby of mine. So I've read some 200 books, maybe 300, 400, all these books and articles. And then we've kind of put that together and maybe 30, 40 different courses that's going to give you just a powerful foundation. And so we'll run that interference for you. So you don't have to come to our school, but if you want a completely integrated and comprehensive program, and you want to be confident that you're going to be equipped and qualified in the most powerful system known to man, we have that program for you.
Jim, as always, an absolute pleasure. Thank you much for sharing with us and always with such passion and eloquence. So really, for those that are watching this video, really hope that you found it informative. This series will continue. There'll be much more content that we'll be posting on our social medias. You can follow us, subscribe to us on YouTube. Do remember to hit subscribe, like the videos, like this one if you have found them informative. And do share with your friends if this is something you found valuable. But thanks again, and you'll see us again next time. Thanks for watching. Don't forget to hit like and subscribe, clicking the bell icon so you're notified whenever we upload.